going to talk about infections in blood cancer patients today, or we call infections in Haemato Oncology malignancies. Now it's quite appropriate these days we are talking about COVID-19 viral infection or infections caused by those viruses. This is nothing new facing infections for Haemato Oncology patients or blood cancer patients. If you look at how blood cancer patients get into trouble or why they get into trouble, or what we call mortality or death in blood cancer patients, almost always it is related to infections. So this task of preventing or managing or treating infections is nothing new to blood cancer patients. Why blood cancer patients are more exposed to or prone to infections is because they are impaired immune system. Our blood and immune system are very closely related. Blood cells are very important in defending us against infections, may it be viruses, bacteria or fungal infections. Now when somebody gets a cancer or a blood cancer, in the system of blood, bone marrow and in the immune system, that defense system breaks down and they get more infections. That is the same reason why we separate these patients. Even before COVID-19 pandemic came, we used to treat them separately, separated from other patients, and also we try our best to minimize their movement. Now we talk about minimizing movement because of the COVID-19, but this is the usual practice in blood cancer patients for a long time. So when the patients move or the staff move, may that be nurses, cleaners or consultants, we carry infections. So it's very important blood cancer patients be treated in one place with limited human movements. Having a separate staff, including consultants, working in one place is critical in treating these patients. And also when they get infections, it's very important to have the expertise of microbiologists and physicians. I myself is a physician. Most of the time when I treat blood cancer patients, I use my physician's skills to prevent them getting into trouble with infections. Talking a little bit about COVID-19, as I told, these problems with infections is nothing new to blood cancer patients. We are used to preventing them and treating them, and now people wear masks even in public. In blood cancer wards, we have been wearing masks for last few decades to prevent infections. There are two things very important happen with the COVID-19 infection. One is blood cancer patients are more prone to COVID-19 infections and they have a higher mortality than the general population. Recently there was a nice article on BMJ depicting that the mortality can go up to about 40%. So it's very important to prevent blood cancer patients getting those infections. And the second is, because of the COVID-19 pandemic, there is a delay in diagnosing and treating blood cancer patients, which can affect their long-term survival. In summary, even before COVID-19 came, blood cancer patients and caring physicians has this challenge of preventing and treating infections, because blood cancer patients are more prone to getting infections due to lack of or impaired immune system. The strategies we use is very similar to what we now use in COVID-19. We keep them separately, reduce their movement and try to prevent these patients getting exposed to infections, viruses, bacteria or fungi. And also it is very important to aggressively treat and get the advice from the physicians and microbiologists in case they get infections. Thank you very much.
Lanka Hospitals. Caring, curing.